Opioids are a class of drugs that include both natural and synthetic substances that interact with opioid receptors in the brain and body. These drugs can be derived from the opium poppy plant or created synthetically in labs. They are commonly prescribed for pain relief, but they also carry a high risk of dependence, misuse, and addiction. Here is an overview of opioids. Types of opioids. First, we have natural opioids, also known as opiates. These are derived from the opium poppy plant. Examples include morphine and codeine. Next, we have semi-synthetic opioids, which are partially synthesized from natural opiates. Examples of these are oxycodone, hydrocodone, and heroin. Finally, there are synthetic opioids, which are fully synthesized in laboratories. Examples include fentanyl, methadone, and tramadol. Mechanism of action. Opioids bind to opioid receptors, mu, kappa, and delta, in the brain, spinal cord, and other areas, leading to pain relief, euphoria, and sedation. The mu-opioid receptor is primarily responsible for their analgesic and euphoric effects, but also contributes to the risk of respiratory depression and addiction. Medical uses. First, pain relief. Opioids are prescribed to manage moderate to severe pain, particularly post-surgical cancer-related or injury-induced pain. Second, cough suppression. Codeine is sometimes used as a cough suppressant. And third, diarrhea management. Opioids like loperamide are used to treat severe diarrhea. Side effects. Common side effects include constipation, nausea and vomiting, drowsiness and dizziness. Now, on the more serious side, we have respiratory depression, which means slowed or even stopped breathing. There's also physical dependence and withdrawal symptoms, an increased risk of overdose, and, of course, addiction. Risks and misuse. Over time, the body may become tolerant to opioids, requiring higher doses to achieve the same effect. Physical dependence can develop, where the body adapts to the presence of the drug. Opioid use disorder, or OUD, can develop, characterized by the compulsive use of opioids despite harmful consequences. Taking high doses of opioids can lead to fatal respiratory depression. Synthetic opioids like fentanyl are especially potent and carry a higher risk of overdose. Treatment of opioid use disorder. Medication-assisted treatment, or MAT, includes several key medications. Methadone, a long-acting opioid, is used to prevent withdrawal symptoms. Buprenorphine, a partial agonist, helps reduce cravings and withdrawal. Naltrexone, an opioid antagonist, blocks the effects of opioids. Naloxone, another opioid antagonist, is used to reverse opioid overdose by quickly displacing opioids from the receptors and restoring normal breathing. Behavioral therapy, such as cognitive behavioral therapy, or CBT, and contingency management, can help individuals change their drug use behaviors and manage triggers. The opioid crisis, particularly in the United States, refers to the widespread misuse of prescription and illicit opioids that led to a significant increase in addiction, overdoses, and deaths. The crisis began in the late 1990s when pharmaceutical companies reassured medical communities that prescription opioids were not highly addictive, leading to widespread overprescription. Key points in management and prevention. Prescription guidelines. Healthcare providers are encouraged to follow strict guidelines when prescribing opioids to minimize risks, such as using the lowest effective dose for the shortest possible duration. Patient education. Patients should be informed about the risks of opioids, including the potential for dependence and overdose. Alternatives to opioids. For pain management, non-opioid analgesics, for example NSAIDs, and non-pharmacologic approaches like physical therapy and cognitive behavioral therapy should be considered whenever possible. Opioids are powerful drugs with essential uses in pain management, but they carry significant risks. The key to addressing the challenges associated with opioid use lies in careful prescription practices, education, and comprehensive treatment for those struggling with opioid use disorder.